Hello, my name is Louise Irvine. I'm the chair of the Save Lewisham Hospital Campaign, and recently I went on a delegation to Greece organised by the Greece Solidarity Campaign to see the impact on the Greek health service of the very harsh austerity measures that had been imposed on Greece. This is as a result of the conditions that the Troika, which is the European Central Bank, the IMF and the European Commission, had made on the Greek government in return for bailing out their banks that were in debt. So I went along to visit, and as a result of that visit and the things I saw and learned there, I came back and told people in the Save Lewisham Hospital Campaign, and we decided that we would make solidarity links with the hospital there that I visited, the Evangelismos, which is the biggest hospital in Greece, and also with a community self-help clinic in the neighbourhood of Peristellis in Athens. And I'm going to tell you in a minute what I saw there and why it moved me so much. When I went to Athens with the Greece Solidarity Campaign, I met health workers, I met people in the community clinics, and we met some politicians and local government people. I was not prepared really for what I was going to see. When we went to the big hospital, we met a lot of staff. Many of them have been sacked or had their pay cut. Services have been dramatically cut. They said that a third of the Greek population now has no access to healthcare. This is because healthcare is based on insurance, and you get insurance through your work. So with a third of the Greek population unemployed, they don't have any access to healthcare, and that means they don't have access to even primary care. Their children don't have access to immunisations. People with long-term conditions like diabetes have got no access to the medication they need. So the A&E at Evangelismos, whenever it was the doors opened, when it was on take 1 in 4, the people just rushing in wanting basic medication for diabetes or wanting to have their children immunised. The worst thing I saw in Evangelismos was in the psychiatric ward. As a result of the fact that a third of the 3 other psychiatric hospitals in Athens have been closed, Evangelismos had to take all the psychiatric patients. There's been a rise in depression and a rise in the suicide rate since austerity. There are a lot of distressed people being admitted into this ward, which was meant to have only 25 people. In fact, they had to have 50 to 70 extra beds to house all these other people, and they were just lined along the corridor in trolleys. A narrow hospital corridor with narrow trolleys on each side, all the way along and then round the corner, and people just there jammed in there, apathetically lying on these trolleys, old and young, men and women. Only 2 toilets between them. Only one nurse who said they weren't able to provide the care they wanted to. Actually, that really moved me to tears. I'd never seen anything like it. I've worked in third world countries. I've never seen anything like that. We spoke to an obstetrician who talked about the criminalisation of childbirth. She said that Greek women are charged €600 now to have a baby, and €1,200 if there are any complications or it's a cesarean section. Many women cannot afford to pay. What was happening before is the babies were being kept back until the women paid up, which meant the babies were being kept as sort of hostage. There was an international outcry about that, so that stopped. But now what happens, the women are expected to pay, and if they can't, their property can be confiscated, or the property of their family or their family home can be taken away from them. And if they still can't pay, people can actually be imprisoned for debt. Many women can't even afford to feed and care for their existing children. The infant mortality rate has gone up by 40% in Greece, according to a report by The Lancet, since the austerity measures kicked in, and 34% of Greek children are living in poverty. Many families are having to rely on the pension of a grandparent, less than €500 a month. We went to visit the clinic in the neighbourhood of Peristellis, which has been set up by volunteer doctors, nurses, physios, pharmacists, and ordinary people in the community to try to provide some basic health care to people, the 400,000 people in the neighbourhood. There are about 50 such clinics have been set up around Greece, and they're actually providing healthcare for about a third of the population. And all this is based on volunteers and on donations, because they get no help at all from the government. I was really impressed by the work that was being done by these fantastic people giving their time freely. But they said, we do need help and we need support. They also said to us, we don't want charity. We want solidarity. We want you to march alongside us and support us in that way, rather than just seeing us as people to pity, because we don't want your pity. I went to a market in the centre of Athens, a solidarity market, and the arrangement there is that to bypass the supermarkets who are making huge profits by going directly to the farmers, ordering food, so the community would order food from the farmers who would deliver, and it meant the farmers got a good price. The people buying the food paid less than they would in the supermarkets, and in return the farmers donated 5% of their produce free that was distributed to families who were suffering from hunger. Across this market was strung a banner saying, "Putting hope into practice." And the people I spoke to said, we have a lot of hope for a better society, and we're taking practical measures now to defend ourselves and our communities. But we're also putting our hope into a new political system. We want to resist austerity. We do not believe this is the answer, that there's any way out for us, the poor or the masses of ordinary Greek people. The money that the Troika gave to Greece never went near ordinary people. It all went there to pay off the bank's debts. Nobody really knows what happened to it. It certainly didn't get down to the level that I saw the everyday people in the streets or in the clinics. People said to us, we want your solidarity, and I took that message back to my friends and supporters in the Save Lewisham Hospital Campaign, and I told them about what I'd seen, and people were so moved and so impressed and so inspired by what they heard that they decided that they would like to make formal links both with the hospital and with the Peristellis clinic. Since my visit, Syriza, the political party that a lot of people there put their hope into, has actually won the elections, and Syriza has committed to reversing the decline in the health service there and to reinvesting in healthcare, and committed to an anti-austerity programme. I think this is very exciting. I think if Greece is able to find a way out of austerity, then it can be an inspiration for all of us, because although in this country we are not facing the same extreme experiences they are, we are still on a trajectory towards deepening austerity. We have heard George Osborne saying that he wants to cut public spending in the UK down to 1930s levels, and I've seen what happens when you do that. I've seen the total destruction of a health service, and I've seen the impact on ordinary people and on health workers. We must never allow anything like that to happen to us, but at the same time this is a European-wide issue, austerity, but it's also European-wide resistance. I feel that we should be supporting our Greek brothers and sisters in helping them to reshape and rebuild their society.